Welcome everybody this morning to the administrative briefing. Appreciate everybody's willingness. I know this is a topic that folks, it's very timely and folks are very much interested in. I know we have a lot of other meetings that everybody's attending these days, so we want to make sure that we are very respectful of everybody's time. We're going to try to stay on point as much as possible. Purpose of this morning's meeting is to talk about new challenges that we're all facing because so many of our community's children will be learning remotely and at least to begin this school year here over the coming days. I think that the county can be helpful in leading some of the helpful responses to this challenge, but those responses can't be haphazard, and it's too big of a deal for us to just put some well-meaning ideas down and not hope that then be hopeful that some of it just sticks. We have to be the effort has to be very concerted. And so one thing I want to start with is that this is not just a discussion that merits about the merits of remote learning or whether we should be having school in person. That's a discussion that's already taken place. Public health has offered, both the county and the city public health has offered their best expert advice on that topic to the area school districts. Those school districts have made all their own decisions, whatever those may be. Nobody here made those decisions or has the power to change those decisions. So there's no point in rehashing that this morning. Even in the best of times, there are plenty of students who start each school year every fall unprepared to learn effectively. Schools work to address those issues throughout the year to give kids the best possible chance to learn. But without having kids in school buildings, though, some of those needs are simply going to be going unmet. In addition, we know that something like a quarter of our students don't have high-speed internet on a regular basis. We're trying to do what we can to address those issues. We passed a resolution yesterday to see what we can't do to help out that situation. Many more will not have supportive family members at home who can spend much time helping them learn. This is an issue that we've dealt with and tried to deal with over the last handful of years. None of them will be getting the social and emotional support that they need and usually find from their friends and their teachers and other school staff at school. Some of you have heard me talk about my kids on many occasions. I have a 12-year-old who's starting 7th grade and a senior this year. So this is a tough time for a lot of kids in many ways. Now that, if you think about, we think about what it would be like if we just left our kids at home all day and expected, my 7th grader or my senior in high school to do their homework on their own. I can tell you from experience here that it wouldn't be pretty. My 17-year-old would do every single project at the last possible moment, and my 12-year-old would start every project on time, but would finish almost none without the help or the help of her mom or her dad, just because she's one of those kids who, while she is smarter than both of us, she likes to know that mom or dad are ready to jump in and make it, just to give her that assurance that she's on the right path. So we're lucky enough to have some other supports for both of our kids. But a lot of middle and high school kids are going to be going at this all on their own. It's not fair to them. And it's also not a great recipe for a successful school year for any of our schools, for any of our kids. So we need to do whatever we can as a community to be helpful. Lastly, I know that the schools have had a lot more time to plan this time around, which is fantastic. Back in the spring, this was kind of something that was thrown, just kind of tossed upon educators. So I want to acknowledge all the good work that I'm sure that they've been doing over the last many months to get ready for this remote learning. We just want to know that it's going to take let everybody know it's going to take a whole community working together to make this crazy school year as successful as it possibly can be for all of our students. And so on that note, that is the reason why when after several conversations that we've had as board commissioners, and as this continued to arise over the last several weeks in our briefing sessions at 9 a.m. With Commissioner Mazzola, Commissioner Mazzola suggested that maybe we ought to have a larger community-wide conversation about this issue. When he suggested that, I immediately thought, well, we need to make this, we definitely need to take Joe up on his suggestion. As before we get moving with the agenda for today, I want to open it up to my two colleagues and see if either Commissioner Brown or Commissioner Boyce would like to make a few comments. And I'd also, before we do that, I'd like to suggest to all of today's speakers, and we have an agenda for today's meeting, but I want to make sure that we suggest to all of today's speakers that we do have a fairly lengthy agenda, so I want to make sure that everybody knows to keep your remarks as brief as possible so that we get through, so that everybody has a chance to ask as many questions as possible. But go ahead. Commissioner Brown?
Thank you. And I just am anxious to hear what all is being done so that we don't get in the way of what's already happening. I know the school districts have had months to plan and really get ready for this year. It's going to be a challenging year, no doubt, for a lot of the schools. But I know that, everybody has been so thoughtful. When the schools shut down in the spring, there was no time to really think through what all needed to happen. And I know there's been a lot of thought put into what's happening in the reopening to virtual or blended class time. And so I want to hear what's happening, and I want to hear what all is being done so that we don't step in and do things that may already be being done. And if there are ways we can be helpful, find out what you really need. And I think that it does take a village to make all of the educational programming work, and we're here to help if you need that, and we're here to be helpful in ways that are really going to be helpful. So thank you for being with us today, and I look forward to listening some.
Thank you, Commissioner. Commissioner.
Hi, thanks, John, and thanks for pulling together this meeting. Let me just say, I, like many parents here, are dealing with both a senior in high school and a senior in college. And so I know what everyone is facing and what they're dealing with. And so I think the more we can do to support our families, the more we can do to support our communities, even though the school districts is not, under the county, but we can be the auxiliary support that families need. And so I'm looking forward to hearing what that may be. I know we've already done a number of things, but we're really at the beginning of this conversation because it's not even September yet, so school's not even going. And so what we hear and learn today may just prevent a lot of the challenges that seems inevitable for us to face this fall. So thanks for being here, everybody.
Thank you, commissioners. I appreciate it. All right, so before we get into the education, with the conversation with the educators, if we could hear from our two public health commissioners or commissioner and director. So first, if we could hear from Commissioner Joe Mazzola from Franklin County Public Health.
Thank you, Commissioner O'Grady and Commissioner Brown, Commissioner Boyce, and others on the call. It's great to be with you this morning. I want to thank the Board of Commissioners for convening this discussion. Very, very timely and very, very important from a public health perspective. Just briefly, I just want to say that from Franklin County Public Health, we've been so fortunate to be able to work with our school districts over the course of the summer as they have prepared to return to the classroom, as well as our university partners as well. And those conversations have been very helpful for us to better understand the challenges that they face as they return into the fall and bringing kids back into the classroom. As you mentioned, public health has made recommendations to our school districts to help inform those conversations. And we really appreciate the opportunity to have that dialogue directly with our superintendents, with our local boards of education, and make those recommendations and have that conversation with them. It's really, for us, it's about, what are we seeing at the community level that really could help inform what's going on or what could be happening at the school district level. And as we all know, over the last 6 to 8 weeks, and Dr. Roberts can speak to this as well, we certainly had a very significant rise in cases for Franklin County over the better part of late June into early July. And that was causing a lot of concern for us as we thought about back to school. Thankfully, over the last couple of weeks, we're starting to see a decline in cases, which we're of course very optimistic about, but certainly very cautious about as well. We know that the community conditions really will impact the potential for cases within our schools. And so, again, we are going to continue to work with our school districts in whatever capacity that they have decided to reopen, whether that's in a hybrid blended model or remotely to start off the school district. And, we have continued that conversation with our school districts and are looking forward to continuing to support them in whatever capacity would be appropriate. We've heard directly from them that, certainly there are many, many issues that they're facing, both operationally, but then also the other supports that they provide to our families and our students. And I'm very thankful that we have so many partners on the call this morning that can speak to those other areas, because we've heard directly from families across Franklin County their concerns and their questions about remote learning and how that may impact their students and their families. So from a public health perspective, we want to make sure that we continue to be a part of these conversations, but we are certainly wanting to do everything we can to impact the community conditions and then of course continue our support of our school districts. So those are just some comments I'd like to share and maybe ask Dr. Roberts for some additional public health perspective.
Dr.
Sure.
Roberts, appreciate it, Joe. Thank you. Dr. Roberts.
Sure. Thank you. And good morning, everyone. And thank you for all the commissioners for having me here this morning. As Joe stated, we have seen significant number of cases here in Franklin County. Franklin County leads the state in terms of our population, but we also lead the state in terms of the number of cases we have. It's been exactly 5 months since we found out about the first case of COVID-19 here in Franklin County. I remember the day well. It was Friday, March the 13th. And I got a call that we had our first confirmed case of COVID-19. So fast forward 5 months later, we're up to close to 20,000 cases in the county. We are at a level 3 or red in terms of the public health advisory system. We are at that level along with several other counties in the state of Ohio. And if you actually look at our case rate per population, I think we fall the 5th or the 6th county in terms of cases per population. But we still are at level red, and that is concerning. I would also say that, Joe is absolutely right. We started seeing an increase in cases right around the end of June, early July, and those cases went up significantly. I gave some guidance, and Joe and I talked around the second week of July about what are we going to do about back to schools. We don't know if these cases are going to continue to go up or not. And at that point, I gave guidance that schools should wait until we see 4 consecutive weeks of a downward trend in cases before they resume face-to-face education or in classroom education. That got a lot of attention by many. It concerned many, but I felt like it was the right thing to do. Keep in mind that when we closed, or when the state closed schools back in March, we had only a dozen cases across the state. So think about bringing kids back to school when you have 20,000 cases, a big difference. But I would also say between March and now, we've learned a lot about the virus. We have a lot of mitigation efforts that are helping us. The first and obviously the most important is the mask. The other thing that we know is about spacing, the social distancing, the keeping of 6 feet apart from other people. And the other thing that we do have now that we did not have in March is we have the availability to test and to get those results back pretty quickly. And we did not have those things in March. So I am happy to say that, you know, over the last 3 weeks, we've seen a significant decrease in our cases. Each week, we've seen anywhere from a 16 to 19% reduction in cases. And I would like to attribute that to the mask. And you and all of our fellow county residents are wearing the mask, and that is making a significant difference. We saw the decrease in cases almost 2 weeks to the date from the time that the city endorsed the mask order, which was July 3rd. And then I know other municipalities followed, and then the state followed up with a statewide mask order. But we've seen a significant decrease in cases since we've all been wearing the mask. But that doesn't mean we need to stop wearing the mask. We need to keep wearing the mask. We need to keep seeing our numbers come down. And we're also optimistic that by the state order to shorten the hours that alcohol can be sold in our bars and restaurants, that will also help bring down our case numbers. So we're watching it closely, but thus far we're going in the right direction, which is, you know, good news for those of us in public health and hopefully good news for all of you as well. And as Joe said, we've been working with our schools, you know, primarily Columbus City schools and Worthington schools, and talking to them and giving them guidance. But we are very, very optimistic about where we are going as a county with our numbers.
Thank you, Dr. Roberts. Now we'll get an update on remote learning and present gaps from the schools. First, we'll hear from Dr. Tom Goodney from the Educational Service Center of Central Ohio.
Thank you, Commissioner O'Grady. Thanks, everybody. Good to be with you. Good to see many of my other colleagues that are on our Tuesday calls again. Very quickly, and I know Talisa will be able to provide some more specifics as it relates to Columbus City Schools. I think, as you all know, every district in Franklin County is offering some form of fully online option for parents. And if at some point in the future folks want to delve into that a little bit more, we've been tracking all of that data. All of them plan to begin remotely per the health recommendations, with the exception of 2, maybe 3 right now. Most recently, the Hilliard City School District Board continues to have some discussion about if we go to orange, opening in hybrid, if not opening remotely, but revisiting that on a weekly basis. New Albany and Dublin are both looking at some hybrid start models that look at 25% capacity, perhaps growing to more students closer to 50, but obviously monitoring the public health data very closely. There are 3 other districts that have approved plans that look to transition to hybrid if possible at some point in the fall, and then a handful of others that have pointed to the first marking period of the first 9 weeks before they would make that pivot. So no one plan, no one approach, local decision rules, and I think everybody understands that. I would just point out that all the superintendents were appreciative to hear about the broadband pilot that the city and county is partnering on, and looking forward to that moving forward. I think that'll fill in some gaps for some folks. If you didn't know, some of that might be helpful because, and Talisa can talk about this, a lot of the districts have been told that they may have to wait until November before they get some of their devices that they've purchased. If this PCs for People arrangement or any others that we're able to bring in that have refurbished devices and they have those available right now, that's a way to perhaps close that gap with some families and with some students more quickly. So that's just a quick overview on that side. John, from your voicemail to me, and I really tried to think about what your goal was with this meeting. you had mentioned some of the areas perhaps that the commissioners could be thinking about. And to Commissioner Brown's point about, we don't want to get in the way of things that are already happening. We want to supplement, we want to complement. We've spent considerable time talking about this, as you can imagine, and up to this morning where I made several calls to colleagues. And without exception, it's childcare. And I don't want to pivot this into a childcare discussion. Obviously, it's about remote learning and the challenges, but this is central to a school district's ability to deliver remote learning, having staff involved with remote learning, parents in the community with their students being able to participate in remote learning. And what I hear are really the same two primary suggestions of where government, county government, city government could be helpful. And that's obviously in the area of resources. Two primary breakouts of resources: human and material resources, and of course, financial resources. In the human and material resource space, we're talking about space, facilities. It was suggested to me, or the question was asked of me, well, if the kids are home learning remotely, why can't the schools be turned into the pandemic childcare centers and ramp up and amp up the number of early childhood spaces that are available to the community? Well, they could, except if we make a pivot in a week to blend it in hybrid instruction, then we need all that space back, and we've got to displace all of those students and all those families. I think depending on the school district, they can take on some more of that, depending on their available space. But this is really about a public-private partnership to this, where we are identifying space, resources for potential capital improvements to that space, to staff it, service providers, potentially transportation, certainly PPE, all of those human and material resource costs to be able to provide for that childcare infrastructure is, again, what I hear time and time again from my colleagues. On the financial resources side, and the commissioners have been very generous to date with CARES Act dollars and other resources, but any money that can leverage with other local monies to be able to provide for those human and material resource costs, but also to get the price point down for families. If they're going from a AM/PM latchkey style model for their kids to now an all-day model, obviously the cost goes up for the provider to provide that. So any resources that allow a family, say that's on a free lunch calculation now, to access that for free, a reduced lunch family for a reduced amount, and a sliding scale for the rest of the family is really, again, what I hear from my colleagues. So they were very enthusiastic that you were hosting this conversation, and I have a commitment from all 15 other of them, and I won't speak for Talisa, but I know she would agree. You have a unified group that if the commissioners want to continue to lead on this, they absolutely want to continue to be in the conversation. Appreciate the time to provide that update.
Thank you, Dr. Goodney. Dr. Dixon.
Oh, well, thank you. I think he said a lot of it, all of it. Thank you, Dr. Goodney, and thank you to the commissioners for having this conversation. What I would like to add that has not already been stating is that this is an opportunity, I believe, for us to change the narrative of what K-12 space looks like. And I think that you can help us do that. We are now will function as schools without walls. We won't have this divider between what happens in the K-12 space and what happens in our partner space. We are truly going to have to come together for our students and our families. I think in addition to childcare, think about how we can help those specific students, or what we call our vulnerable youth, those who are foster care students, or those that live in shelters. They need something different. They need something more in many cases. And how do we bring those students back in a hybrid model when they have to travel out of a shelter, for example, and back to a school and so forth. We need to be mindful we can have some help with that. Also for us, although we're going to start remote, for us, transportation is still an issue for Columbus City Schools because we are obligated to transport 15,000 students from charter non-publics. So even in a hybrid model, we aren't able to bring our high school students back to school. So finding ways that we can still educate our high school students in a blended model, and how would that look for space and transportation? It would be wonderful if we could kind of just get rid of our transportation model as it is and reimagine something different too of how we transport students and our public in the city. I'm not sure what that looks like, but I think there's some opportunity there. Again, helping our families find places for our students. I think these learning educational centers are going to be so, families going to be grateful for those. Going to help families a lot, and I'm looking forward to seeing more of those and more organizations get involved in that and opening those up in our neighborhoods. And then finally, I think neighborhood schools, even for Columbus, we really are rethinking neighborhood schools now, right? We are open enrollment districts, so our students can go to any school. However, we are creating these community hubs where families can go get their grab-and-go meals. We're partnering with Nationwide Children's Hospitals, so we have our mobile units. So we want to be able to create those hubs throughout the city so that our families won't have a far reach to get the additional supports that they need. And lastly, I just thank everyone who's been supporting us. It's a heavy lift. I think Tom would agree, Dr. Goodney would agree that, as superintendents, we've had to make a lot of tough decisions, and it gets lonely at times when we think about the organizations we serve and the decisions that we make, and still yet have to be hopeful for our students and our families that there's a brighter day ahead. So a thank you to all the people who have partnered with us to make these decisions. And I am very hopeful that together we're going to provide the resources for not only our students, but for our families throughout Franklin County. So thank you.
Dr. Dixon, thank you. So what I should do before we move on is a couple things. One is to let you know, I know Dr. Goodney had indicated childcare was a definite need, and I know Dr. Dixon has indicated transportation. When Director Bivens makes her presentation, I am certain that she is going to address childcare, and I'm watching the screen very intently as Mr. Wilson is making notes there. So I would imagine that before the end of this conversation, certainly have a conversation about transportation, and Director Bivens may also have some thoughts on transportation as well. I don't know what the exact, and that's a big lift, 15,000 kids, but we may have some thoughts, or at least we may have some the ability to have some conversation about that. But that is a pretty big lift. I understand, but certainly we are open to the conversation. But thank you guys for your thoughts there. But we'll continue on with the conversation. One of the other thing I would like to do before we move on is to remind folks to please check their devices and make sure that they're on mute. We were having some interference there briefly. Next, we're going to move on to have a conversation on food distribution to students and their families, and we'll have a presentation from Matt Habash from the Mid-Ohio Food Collective.
Thank you, Commissioner Brady, and welcome to everybody. Thank you for this opportunity. Just to give you a sense of where we are right now in Franklin County, since March 1st, we have already helped over 82,400 families in Franklin County, with about over 330,000 visits to a food distribution center of one kind or another. This does not include our distributions at schools and partnerships with a lot of other folks. This is basically people that have gone to a pantry or to a produce market to pick up food. The amazing stat in all that is 20,653 as of yesterday families are brand new to our system, have never ever asked for help in 10 years of collecting data. So for us, that's the piece that we're trying to really address, and to make sure that people know food is available. Thanks to the commissioners and the help they've already given us, has made this invaluable. Hopefully the city is going to do that soon as well, so that we can continue to make sure that we're distributing food. I actually have a 20 county territory and I have 101 school districts in my 20 county territory. So we are literally going to have a call next week with a number of superintendents and some food service folks to really understand district by district what are the needs and what can we do to help, recognizing we've got a number of school districts in Franklin County. We have partnered really well with Columbus as they were trying to feed folks early in this process, with Southwest Schools, with Westerville and Summer Feeding. And we'll continue to do that. I really like Dr. Dixon's idea. The hubs for us makes sense. And when you give kids only a little bit of food at a time, and it's only people that are in proximity to the school, and if USDA doesn't change the rules, as of last week they hadn't, I don't know whether they're going to for the fall or not, to make it easier to serve. We're going to need hub locations so that we can distribute food along with a lot of other products and services and make it as easy as possible. Right now we have food, and I want to make sure that's really everybody tells me, if you need food, we have it. We've been blessed with the help, again, with the commissioners. We've hired an additional 26,000 temporary people and 26 temporary folks to go along with some volunteers, and the guard we're down to 48, but we at least have the guard through at least September and most likely till Christmas. So we've got the ability to get food where it needs to be. The really good thing in Franklin County and across our territory is 95% of our partner agencies stayed open, so that we've been able to get food to the normal places people would pick up food. But we think it's going to make more sense to have hub locations where people can avail themselves of a variety of things at one time. So we're planning to do that as well. Our market in Reynoldsburg has been wildly successful, the one at Columbus State. We're looking for a Morris Road location, a West Side location, as well as we're going to do more in Grove City. So that's the plan for the near term in terms of opening up, but partnering with anybody that wants to partner with a food distribution where it makes sense, so people can avail themselves of a lot of things at one time to make it as easy as possible, burn a lot less gasoline, and reduce frustrations. For us, that's the key point. My big concern is literally what happens after January. So we're already in planning mode for acquiring even more food, even if I have to stockpile it, so that come January, the trade mitigation food that was a big source of food for us, and a lot of fresh food and meat, is ending in December. That was all pre-COVID. There's an additional produce box program and dairy box program from USDA that's ending in December, and there's been silence from Washington as to what happens in January. So we did it early in this pandemic, where we ordered 135 tractor trailer loads of additional food before we even had the dollars to pay for it. We've managed to secure those dollars to make sure we have that food. We're continuing to bring in food, and I'm looking, if nothing changes, we will definitely stockpile food over the next couple months. I have another warehouse in addition to the big warehouse in Grove City that we will put food into to make sure we have food. It's the one thing, I just wanted to assure folks, with the help of everybody, both private and public, we've been able to acquire food and make sure it's available for people that need it. And I want to encourage anybody on this call, if you know people, or if we can combine some of the distribution points so that we've got, good distribution centers scattered throughout Franklin County so people can access it on a regular basis. And we're really getting really quick at it. So unfortunately, our numbers are going back up. And that was the scary thing since the $600 has started to end. We had our busiest Tuesday ever, and a week ago we had our busiest Wednesday ever. So we're seeing an increase and an uptick in the numbers given the end of the additional $600 subsidy. So given what's going to go on with schools is really paramount, because schools have been such a strong feeder of making sure people get access to breakfast, lunch, and even our after school programs. So we're real concerned, but want to do whatever we can to partner with. And again, thanks to the commissioners and to a lot of folks in the private sector, we've been able to acquire the resources so that we can deliver what you need where you need it.
Thank you, Matt. I appreciate it. We will, by the way, I want to remind folks, we will get to questions collectively at the end so we can get through the presentations. I appreciate everybody being patient. Next, we will have a presentation on the role of Franklin County and the services available in schools and the impact on remote learning from the Director of Job and Family Services, the fantastic Joy Bivens.
Good afternoon. I don't know if it's afternoon or morning anymore. Good afternoon. Good day, everyone. Let me just,
Good morning.
hello. Hello. I don't even know what day it is. Thank you all so much, and thank you, commissioners, for this opportunity. One of the things at Job and Family Services that we want to make sure that we do is support the districts. So to Commissioner Brown's point, I apologize, we didn't want to just start doing things without understanding what the need was. So one of the purposes for us listening in today is to see where we need to possibly dispatch some of the services. As many of you know, our agency provides public assistance benefits to the community. We pre-COVID, I'm gonna touch on SNAP or food assistance. Pre-COVID, we had about 120,000 food assistance customers total across the county. Since COVID has hit, we've received nearly 40,000 new food stamp applications. So as you all know, and we all are feeling the impacts of COVID, our work has increased. Now that there is remote learning in place, our concern at Job and Family Services is, like many of yours, children receiving food during the time that they're going to be home. Because what we know is many times there are children around the county who do not receive meals even on the weekends. That's why school provides that safe place for them. So we're trying to figure out what is our role and what do we need to do. But I will give you just a few high-level things. High level, as you all know, the commissioners approved the budgets and the programs through Job and Family Services. Our agency provides up to $5.4 million in funding to more than 20 community agencies for in-school and after-school programs that support thousands of students. We also provide more than $1 million in supporting school services like I Know I Can, Big Brothers Big Sisters, the PAC Healthcare. We recognize that COVID has impacted a lot of these in-school initiatives. That's why we allowed many of our providers, to provide a virtual opportunity for students so that they can still receive those supportive services. We have also worked with Columbus City Schools to increase the access to the pandemic EBT card, which provides families with additional money to buy food for COVID-19 related closure. We are committed to exploring other opportunities as we see fit through this time. As we're listening to the hubs, our team just sent me a communication. One of the things that for us, again, listening to all of you and how we can support is currently public funded childcare is put in place to support centers and homes that have been approved through through the state of Ohio. Many times there are programs that are before school and after school that public funded childcare pays for as well. We are looking at supporting and suggesting to support the drop-in hubs with a limited number of full-day sites. We also will be providing childcare providers support grants in partnership with the City of Columbus so they can buy more equipment and so they can obtain their STAR. As of late, the data suggests that 93% of the programs in Franklin County are now STAR rated. So there's a lot of things I think that Job and Family Services can do, but we want to make sure that we're targeting the services in the area that we need to. And in addition to the public assistance benefits, there are just supportive services that we have, the commissioners approved dollars for nearly over $30 million, as I said before, in after school enrichment services, summer youth programs, all these services that we provide. And what we will be willing to do is put this in a repository so we can send out to all of our districts so that if they need to plug young people into, that they will have that repository to assist in referring those families. Did I do my job, Commissioner? I hope so, because there's a lot.
Can I answer that question?
No, you cannot. I have 3 computers up right now trying to figure out.
Clerk in the line, can you mute Commissioner Boyce for me, please? Until we get through the presentation.
Look, you said you wanted to see my face on here, so here you go. Okay, I'm gonna mute myself. I'm gonna do you all a favor. I'm gonna mute myself.
Happy to see your face. Just want to mute your voice until we get through the.
I'm gonna do both.
Save
me, Commissioner Brown. Save me, Commissioner Brady from Commissioner Boyce. Save me.
Next up, we have a discussion about mental health during in remote learning with Erica Clark-Jones, the CEO of Adam H.
Good morning. Thank you, President O'Grady. Good morning, Commissioners Brown, Commissioner Boyce. Thank you, and all of my esteemed colleagues, public friends. Thanks for having us on, and thanks for including us. As you know, Nationwide Children's Hospital in the last year embarked on an anti-stigma campaign around behavioral health. This is how the stigma gets broken, by being included in these community-wide conversations. And so I really appreciate the opportunity to be a part of this group when we're talking about school reopening. I have a few remarks I just want to touch on, and I also want to introduce 2 colleagues that I brought with me today. Mr. Greg Jefferson from Community from New Directions. They're working in the field with families and parents right now and want to be able to share what they're seeing, as well as Linda Jakes from Concord Services. So I'm going to quickly state my points and then yield the rest of my time to them. But just as a reminder, the mission of Adam H is to reduce the incidence, and please pardon me, there's construction going on behind me. So if you hear something, that's part of it. So Commissioner O'Grady, I can't mute my phone during my presentation. So just bear with me there. But, it's our goal to reduce the incidence of mental health problems and the abuse of alcohol and other drugs. And early intervention to that is key. That's why the Adam H Board started investing in school-based suicide and alcohol and drug prevention programs 20 years ago with Columbus City Schools. And that relationship has been ongoing throughout this time. But about 7 years ago in 2013, we expanded our investments into the suburban school districts. So at this point, we invest annually about $4 million serving all 16 school districts across Franklin County. So as you know, Adam H does not provide direct services. We contract with 33 provider agencies to do this work. And many of those provider agencies are working with those school districts. Most of our school districts they either work with one or more of our community-based providers, and the list by school district is now on the Adam H website. We uploaded it just in time for this conversation, and I know we're going to be doing some public relations work around this topic. So you can log on to adamhfranklin.org, click on the school district, and you'll see the mental health or behavioral health provider that is working in that district as we speak, as a resource for families, for teachers, and for students. So just to talk a little bit about these services, the providers that serve the school districts support the mental health needs of our students, the families, and the teachers with resource programs for the following areas. Emotional support, especially prevalent in mitigating anxiety and surrounding the unknown schedules and expectations that families and students are going through. Suicide risk and prevention strategies, because that's really important during this time of isolation. Drug and alcohol use prevention, parent support workshops, because we know there's a lot of parents making decisions about childcare and other things and their time in the workforce and how to balance all of those things, and early intervention for students who need additional mental health support. However, this new remote learning environment has presented a challenge for our providers to stay connected with the students and families that are in need of support. They have expressed that. They know that it's a challenge to even reach these families. As a result, our providers are looking at different ways to connect with students and families and teachers using some of the existing online platforms that school districts are currently using or implementing for their school reopening plans for students and families. But there's more work that can be done. Some of these platforms work well together, others not so much. So I think there's work to do there where our behavioral health specialists can connect with the school district's online learning platforms. But some examples of where this is working is Columbus Public Health, led by Dr. Mashika Robertson Centero, are using Google Classrooms to provide suicide, drug, and alcohol prevention programs. North Community Counseling is offering free back-to-school support groups that will take place online to maintain social connectedness and support for emotional wellness, even though the kids and families are distanced. And then CompDrug is doing a virtual conference for youth to support connectedness and empowerment for students. We also have National Church Residences got a national FEMA grant to make sure that they are being a resource for providers to refer into for cases that they can't handle alone. And we have a contact information to be able to connect with National Church Residences. However, I would be remiss if I didn't mention that it is with the support of Franklin County voters and the commissioner's support that we're even able to assist our providers in making these connections with students. And we'll continue to adjust our services as the needs intensify. I heard Dr. Talisa Dixon say, you know, the use of these hubs. That's a perfect way to include our behavioral health network in these group spaces where families are visiting. And so again, that would help break down the stigma to say, if you need help, you want help, you're feeling anxious, or you need additional support and strength, we also have behavioral health specialists in these hubs. We'd also like for any of our partners on the call, perhaps there's a way to work with Mid-Ohio Food Bank and others to make sure our resources are in the same spaces that families are visiting. So I mentioned I'm joined today by two of our providers working every day with families and schools. And so I'm gonna yield my time to them. But before I go, this is what we're stressing here at AdamAge. We are stressing real-time connections, real-time resources for real-time connections to expert help. And I can't end my comments without saying, stressing again, the list by school district is on adamhfranklin.org. If you're in one of our suburban districts and need to connect with a provider. But if you notice a child, or any of our folks here on the call, notice a child that's experiencing a mental health crisis, this is where we connect with Nationwide Children's Hospital's crisis line. They're available for support 24/7. And then of course, our teen suicide prevention hotline is also managed by North Central Mental Health Services. So these are important numbers, and that number, by the way, is 294-3300. We're working with our state partners to make sure we're promoting these numbers and these resources widely. At this time, I'm yielding. I'd like to introduce Greg Jefferson, President and CEO of Community New Directions, and Linda Jakes, Executive Director at Concord Counseling, to share examples of how the network is adjusting currently to meet the emerging needs of families that they're with programming in Franklin County schools. Greg? You're on mute, Greg.
Forgot to unmute. Thank you, everyone. Thank you, Commissioner. So when COVID first hit, the first adjustment was to just maintain communication with our families. And let me back up and say, we're in 21 different schools, Columbus City schools. We're also in Reynoldsburg City schools, and then we provide after-school programming. And so we wanted to stay connected with our kids. And so we reached out to the families in March via phone. And then immediately after that, we set up Zoom. And we've been doing what we call virtual meetings every Monday and Wednesday. The Monday meeting is actually called a Mental Health and Wellness Mondays. And it's just an opportunity for the kids to check in, share how they're feeling, ask questions, and we also take their questions and then bring in speakers the following week to address their question. So we've collaborated with Nationwide Children's Hospital by providing speakers, NAMI of Ohio, St. Vincent's, And we've continued to do that. Also during the summer, we assisted Columbus City Schools with the school lunch program. Our staff were out passing out lunches. And then during our summer day camp, we became a school lunch program ourselves. So as we move into the fall, we're going to continue our virtual services as best we can. I guess probably as I think about maybe gaps in services, I guess the transportation is an issue for us. We have a fleet of vans, but we're looking to see how to make them more COVID responsible. And what I mean by that is we're looking to get plexiglass shields installed in each of the seats and see if that can help us so that we know that when we do return to full after school, that we'll have everything set up and we'll be ready to go. Thank you.
Thanks, Greg. Linda?
Yeah, hi. Thank you for having me today. And I want to also thank Adam H. for bringing prevention programming into the suburban school districts. We had been working with the New Albany School District and Westerville for years prior to this, but these additional dollars have allowed us to kind of really do a lot more robust work. I guess in the spring, when all of a sudden everybody had to go remote, we were all scrambling to figure out how the heck are we going to do this? You know, it was a brand new world. And we are fortunate in the 4 districts that we're in. We are in Westerville, New Albany, Gahanna Jefferson, and Groveport Madison. All of them are using Google Classroom. So it was a platform that we were able to kind of step into pretty quickly. We had been doing some group work on that platform before, and then we really just kind of changed our protocols and processes in terms of how we reach the kids. A big piece of that was partnering with community organizations. We partner with neighborhood bridges in every district. We partner with the food pantries there. We also started partnering with Parks and Rec. That has been a really helpful kind of inroad because a lot of families were using them for different classroom activities, and it allowed us to connect with them in that way. I really like Dr. Dixon earlier said we have to look at this as an opportunity. And in many ways, I've noticed some opportunities that have come out of this that I'm hoping continue past this time. One of those is we're already starting to work with kids and family. Used to be, before we had this pandemic, we didn't start till the school started. And that's when we started working with kids in schools. We are now already doing consultations and helping kids, providing groups for anxiety in terms of coming back into the schoolroom. So that has been one of the first things we've done. We've also found that it allows us to be a little bit more nimble and flexible in when and where we're providing these. It was always done during school hours. We are now able to do evening hours. We're able to do weekends. We're able to do a lot more in the moment situations. We found that our consultations with families and parents has increased by 20% just through the summertime, that people are starting to reach out a little bit more. One of the things that we've done really in terms of treatment, and we started this a couple years ago, but we found that when we did referrals, we'll be working with folks. Wellness is our focus. We're trying to make sure that we're looking at prevention of people going into a more higher end situation. But when we found that we needed to refer people into, or kids into, or families completely into a higher end or a more counseling situation, that we would only get about 50% continuation. What we did with that is we started providing therapists in the schools. So we're putting, and now we're doing it virtually, but we are putting therapists that can be referred into the school district, so we don't have to worry about parents having to bring their kids in, kids can actually see a therapist if they have that higher need, either virtually as we're offering now or in the school during different times. I think I'd have to say the hardest part of what we're doing right now is being able to assess in a way that is not visual. We can do it over video, but a lot of times you don't always see the things that you need to see, and we have to rely a lot on reporting, either by parents or someone else. So if there is a piece that I find disconcerting with our current environment, is the actual visual touch of what we do with the kids. Sometimes you can miss things. But we've done a lot of training this summer for our folks to really be able to step up how they interview and the questions that they ask to determine this in a different way. So thank you for your time.
Thank you.
Commissioner O'Grady, you're muted, sir.
You know, I always chuckle about who does that, and then here I went and did it myself. Thank you, Dean. So Erica, Greg, Linda, thank you for that. So now we've come to a point where we'd like to have an open discussion from everybody on the call. If you'd like to, Dean, do we have a process whereby folks who would like to ask a question or be involved in the conversation, you may want to do this?
I'd be happy to, if folks want to raise their hand, they can do so by turning their video on. I actually had disabled the chat function because it's so hard to keep track of comments while trying to engage appropriately.
That'd be great. If folks want to raise their hand, if they have a question or if a comment they'd like to make, the clerk will recognize them, and then we can go ahead and get folks involved in the conversation that way. But we'd like to open the conversation. If people have questions for either the public health commissioners, the two educators that were on earlier, Dr. Dixon or Dr. Goodney, Mr. Habash from the Mid Ohio Food Collective, Director Bivens from Franklin County Children's Services, or any of the professionals from either Ms. Erica Clark-Jones from Adam H. or either the two providers that she had with her on the call, or if folks just have comments that they'd like to make. I guess we could maybe begin with if either of my colleagues, Commissioner Brown or Commissioner Boyce, has a question or a comment that they'd like to make.
I'll defer to Commissioner Brown first.
You know, I think this has been very helpful in hearing the needs. Certainly heard about childcare, certainly heard about transportation being issues, and the generalized issues of what we already know to be true, that those children and families that have needs, generally, whether they're in the classroom or not in the classroom, those that are homeless, those that have foster care needs, those that have mental health challenges, those are the families we need to wrap around services. And we have all the partners here around the table, our JFS team, the Adam H team, the health departments, and everybody else. Is there anything specific that we're not doing or that we need to do more of that we're not doing that the community could do more of, I guess, is the main question. And whether it's us as the Board of Commissioners and our agencies, or that we put a call to action out in the community to get others to do what specifically can you think of that would be the most helpful right now for the families that we're serving throughout the community right now, as we're in this mode of education the way it is?
Who were you directing that towards, Commissioner?
Anybody.
Universal.
Everybody, anybody. Because it's, this is a moment in time that I think we can mobilize others in the community as we look forward. And, this is a public-private partnership waiting to happen. And I think if there are needs that we can amplify, if there are, and fill those needs and amplify what we're doing that works, I think that would be something we can do.
Commissioner Brown, if I can add, I think if we could perhaps think about what that strategy looks like, because I've heard some great things today. So how do we align those so that that my families, because we're working on some of these same issues, right? So if there is a way that we can have a strategy so that we are informing our parents of these opportunities, and then that's another platform. And if we need to, we know if we need to have more mental health providers, et cetera, we know exactly who to go to. But how do we make sure our families know about food, right? So we're working now to provide grab and go meals for our students and trying to do it so they can get maybe 3 or 4 meals, or maybe get all 5 meals for the week, so that people are not going back and forth every day. So I think if we could somehow message this, that, the county is wrapping themselves around our families, et cetera. And maybe that is a way that families understand that they're, that we're in this together, and that you don't have to go to so many different places to find out where this support is. It's on one platform, and I'm not sure what that looks like, but that would be helpful.
I think you're right, Dr. Dixon. I think that makes a great deal of sense. We've been trying to make it simpler because our families really don't care where the information comes from. They just want to be able to get it from one place. And I think that would be a great help if we could strategize a way to get the information all in one place so that everybody knows, and we can all amplify messaging to everybody in the community that this is where we get information.
Commissioner Boyce, did you have?
Yeah, thanks, Commissioner Grady. One of my questions was going to be what Commissioner Brown just asked, but I'll maybe build on it. And this, maybe I'll direct my questions to the health commissioners, Joe Mazzola and Dr. Roberts. There appears to really be no end in sight. And I know from a medical or science standpoint that no one wants to say, here's when this is going to be over, here's when things are going to turn. But I'm just wondering that should this really stretch out into, say, next year, mid next year sometime, how much more do we have to do? Like what will happen come January and there's no vaccine, it's still growing, it's still a global pandemic, the economy's still weak, there's political pressure to do more. How prepared are we for that? Because what I worry about is not the fall so much for schools and families, because I think we're all in that mode of adjusting our lifestyles, and it's been that way this year. But I wonder what that means to the schools and those families if you prolong this out even more. And so I'm just wondering, how are you all thinking of this
scientifically and with long-term strategies as it relates to families and all of the, from the mental health issues to the medical issues that are, I think, popping up up and down the board. But, you know, listen to what everyone touched on.
Well, if I may, Commissioner Boyce, you know, I tell my staff all the time, this is a marathon, not a sprint. And, you know, I remind everyone that the 1918 pandemic lasted 2 years. Yeah.
That's scary.
Yeah, 2 years. Now, we have some advancements in 2020 that they didn't have in 1918. Science is on our side, technology is on our side. We have the opportunity to create a vaccine that they didn't have in 1918. But we're in this for the long haul. And, you know, from the health standpoint, I think we can manage the health standpoint as best we can. I am more concerned about the financial fallout from this, as well as the educational fallout. You know, how will our kids be on the other end of this? How will their social skills be? How will their coping skills be? Not to mention, how will they learn? Will they be able to pass tests? What does this look like in, you know, 5, 6, 7 years when we've got kids applying to college who might have missed potentially 1.5 years of education or in classroom education? So I think until we have an effective vaccine, and I really want to specify, it needs to be an effective vaccine. There's a lot of talk and a lot of information about vaccines, and they're coming, and they could be here as early as December or as early as January. But 1, the vaccines have to be effective. 2, we have to have enough of them. And 3, which is probably the more challenging part, is we've got to have people who are willing to take the vaccines. And, you know, when I look at our community, you know, we don't know what our flu vaccine uptake is in our county because it's just not reportable data that we know. But we guesstimate at best it's maybe 30% of our population who gets the flu vaccine every year. And so if we got 30% to also get the COVID-19 vaccine, that could be a win for us. But we don't know. That's a big unknown. We're making plans already to provide that vaccine and what that would look like, making it easily accessible, making it at drive-in locations, just like we do the testing. But I think we all need to prepare for the worst in terms of this is going to be a long haul. And so, you know, and I know that I was on a call yesterday morning with the superintendents, and I hope they didn't think I was being short or rude with them, but if we have a window right now for our kids to go back to school and have face-to-face instruction, we might want to take advantage of that, because I can't predict what November will look like. I can't predict that November will be better or worse or the same as it is now. It could be worse, and then the kids will never have face-to-face instruction this year or this semester for 2020. So it's a challenge, but we don't know. This virus is unpredictable. We're learning new things every single day about it. We don't have any experience with it, and we have to do the mitigation efforts that are hard for us to do, but we have to continue to do them, which is wearing these masks, avoiding large crowds, avoiding even small crowds. I mean, people think that it's just, oh, I'm just having 15 of my closest friends in my backyard. I've heard so many stories of how that has turned into 3, 4, 5 cases of COVID-19, and sometimes even, unfortunately, a death, because they thought it was just their family. They know everyone, but knowing everyone in this virus, this is not, you know, and this is me from an infectious disease standpoint, this is not an STD where you're like, oh, I know them, I know they're good. No, this is different. People don't even know. 40% of Americans have the virus and don't even know it. That's a lot. 40%. They say 40% are asymptomatic.
Wow. That means that more than likely there's a good portion of the people on this call right now that have it and don't know it.
Correct.
Yeah.
Commissioner Boyce, I just, if I could, and I would absolutely agree with everything that Dr. Roberts just said. And I think, you know, we should plan for the worst, but we should also try our best, of course, to maybe look at an opportunity that's ahead of us, that maybe we could have circumstances that we could achieve that will get our kids back in the classroom. And we don't know exactly how this is going to play out. And I think flu season is going to be a big complication here. And so we need to start talking about that as aggressively as we can. But we do have a window here. We have a window of an opportunity to perhaps achieve what other parts of the country have achieved. And that is some kind of sense of normalcy. So if we want to get our kids back into the classroom, the best thing we can do is improve the community conditions. And right now we're starting to see improvement there. We've got a long way to go. But if we can, over the next 4 to 6 to 8 weeks, continue in that regard and make those improvements, we will be able to get kids back into the classroom. But the goal is to sustain that. But there's so many factors with this. I'm optimistic that the scenario that could be ahead of us will be a better one than maybe what other parts of the country have experienced. And it's really to the credit of all of the individuals who are on this call and our residents. But we have to do all those things that Dr. Roberts just talked about. We can't let those what are maybe some would consider little decisions have big impacts. And that's what's happened over the course of this pandemic, is that we have made decisions. Every decision needs to be thought of in that way, that it's going to impact not just yourself, but it's going to impact someone you'll never meet. And so, we have to take this opportunity. We have something ahead of us that could be a potential where we could continue some sense of normalcy with respect to back to school. But I appreciate your question, because there is that possibility that we could find ourselves in a very difficult position at the end of the year, and not be able to get our kids back in the classroom in any capacity, which would have, of course, detrimental effects, on them in lots of different ways. And so appreciate the question, but I'm hopeful that we can continue to make some improvements.
Yeah, thanks.
Commissioner Boyce, I'd just like to take an opportunity, because I think it's a great question that you asked. And I'll tell you how, we're thinking about it in terms of big picture at Adam H. So this is a great opportunity to redefine what behavioral health is. As people get stressed and under adverse conditions, people notice things. And in the communities that have traditionally been disenfranchised, people don't act on what they see or what they experience. For us being able to illuminate the paths of support where people are going when they're in crisis and talking to folks that perhaps aren't professionals is a great way for us to start meeting people where they would naturally go, not necessarily forcing them to come to a place where they wouldn't often visit. So redefining what behavioral health and healthy emotional wellness looks like, it's a great opportunity for us to do that. And that, of course, helps to eliminate the stigma. Another thing that we can do, and again, great question, we can train more people in mental health first aid. There's been a movement over the last 3 to 4 years, really getting lay people to be trained in mental health first aid. Let's expand that, because these are the people that are having one-on-one relationships, our counselors, our teachers, our faith leaders, folks in the church that are interacting with family members and so forth. So training them. And then lastly, these peer recovery supports. Increasingly across the country, peer supporters are becoming a national best practice. What better time than to make use of folks who've been through recovery or through a journey that we can train, that are relatable and trusting as messengers to be able to go out and connect with our folks. So I think really putting some investments in those space will help us in the long run. Thanks.
Thank you.
So I'm going to jump in here if I can. So I have some questions as well for Dr. Robertson and Commissioner Mazzola, or a question. First, I should let Dr. Roberts know that yesterday I got my 21st annual flu shot. So, and I am constantly telling folks that they should be getting their flu shot, that, if you don't get a flu shot, that's just kind of a ridiculous notion. I have had the flu one time in 21 years. It was the worst case of the flu I think I've ever had in my life. That one time I did get it, but I've had the flu one time in 21 years. So it's pretty good reason to get a flu shot. That being said, my wife accuses me all the time of being the downer on this subject, but I'm gonna do it anyway. And I've had this conversation with Commissioner Mazzola on a number of occasions. So, here we are getting ready to go back to school. Whether it's at first, I guess most districts are looking to go back remotely. And I have educators in my family, by the way. I should start by saying that I have a couple of teachers in my family, a couple of very close friends that are school administrators. So this is not something that I just this is important stuff in my family. But we're getting ready to send kids back to school. We're getting ready to put in some of these districts and some of these schools, even in a hybrid system, we're getting ready to put hundreds of kids back into the hallways together, into classrooms, even in a hybrid situation, together with teachers. And it strikes me as a recipe for disaster. Here we are. Joe has been giving us the great news over the last few weeks that our numbers are slowly heading in the right direction here in Franklin County. We are very, very slowly on a march towards orange. But now schools are getting ready to open, and we're putting a lot of kids into and oh, by the way, I say this with knowledge of children. I was one myself at one point, but I also have 4 kids, and I know how kids act. I know how kids act when they get together. I know how kids in junior high act. I have one. I know how kids in high school act. I have one. I've had 2 previous to this. They don't follow rules. They don't wear masks if they don't have to. They don't social distance. They don't remember to social distance even when they're reminded. They like to play a lot of touchy-feely, grabby games. They like to they just aren't. And oh, by the way, they aren't concerned about this stuff. My kids are more concerned about this stuff than the average kid out there, because they live in this house with myself and my wife. For those of you who know my wife, we inundate them with all this information on a regular basis, and so they know. But their friends aren't concerned with this stuff. None of their friends are. And so these kids are all universally going to go back to school, and with unconcerned. And oh, by the way, we see news reports of this all the time. Into classrooms with teachers who are one of our greatest assets. And we're going to get a lot of people sick because people are back to school. Now, granted, all parents want their kids back in school. My kids both learn better in classroom situation than they do remotely. It is no doubt that is the case. But aren't we just getting ready for our numbers to go back into the stratosphere again? Aren't we just sending our kids back into a bad situation? Nobody wants their kids to be everything to go back to normal, or our situation to be better than it was, and nobody wants life to be back to normal more than I do. But I just don't see this sending kids back to school ending in a good way for any reason. When you put that many people back into a situation, I just, my guess is that we're going to be a month from now, we're going to be having our conversations, and we're going to be talking about increased numbers of sick people. We're going to be talking about teachers that are, sick. We're going to be talking about it, school administrators that are sick. We're going to be talking about bus drivers that are sick. Well, I don't know, maybe not bus drivers, but we're, am I wrong? Am I wrong to be thinking this way? Am I wrong to be Debbie Downer on this stuff?
So, from my vantage point, I don't think you're wrong. I mean, we've been very clear with the schools. When you reopen, you're going to have a case. You're going to have a few cases. And we're preparing them and preparing ourselves of how you respond to that case. making it clear to them what they need to do, and really setting the expectations to the parents that, you know, just because you hear about a case in your school doesn't mean your child was exposed to that case. There's a process, and trying to be upfront with everyone so they know what to expect when there's a case, how they're going to get informed, how the school is going to inform parents, how the school is going to inform public health, how the school and public health will work together. So you're not wrong. There will be a case in a school or two or three once we get back to the classroom. And we're preparing ourselves for that. I guess what we don't know is how many, how effective the kids as well as the teachers will be to getting the students to comply with wearing the mask. The masks are very effective. And the plans that I have heard from schools who are planning to do some type of hybrid, or even, you know, some schools are doing 5 days a week. Some of the private schools are doing 5 days a week. The plans they have in place for social distancing, for restaurant breaks, for cafeteria time or lunchtime, for playtime, on paper sound good. Now, how they'll be able to put them in practice, and will the teachers and the staff be there to help enforce that? But on paper sound good and realistic, you know. But again, they're kids, as you said, and so they're going to need some coaching, some reminding, to wear the mask, to, you know, play separately as best they can, and things of that nature. But I would also say, you know, adults haven't been perfect either. And so we can't just put this on the kids. I mean, we've seen a lot of behaviors in our adults that have been, you know, we've seen it. We've seen it on social media. We've seen it on the TV, whether there's been pool parties, house parties, bar parties, where people are just acting like it was pre-COVID. And they could be close to each other. They could have large groups of people together. And so it really comes down to, we as Franklin County residents, we as US residents, we need to change our behaviors. The virus is not going to change. We have to adapt ourselves around the virus. The virus is not going to adapt for us.
Yeah, well, you know, Joe's heard it from me, and as have others on these meetings. If I don't trust the adults, how am I supposed to trust the kids? Because the adults are responsible for the kids. Well, I'm concerned. I'm definitely concerned for the kids, but I'm concerned for the teachers. I'm concerned for the educators. I'm concerned for everybody that's in the school building, you know, and I'm concerned for the parents and the grandparents and the aunts and the uncles and everybody that the kids are coming back to at the end of the day. You know, I mean, you know, there's anyway.
Well,
for a lot of people on here, I'm sure I'm sounding like a broken record.
You know, I think your concern is valid. You know, I'm concerned too. I'm concerned with OSU students coming to campus, moving in today. I'm concerned with the schools that are, you know, doing 5 days a week. But at some point, we have to at least try and see what happens with the appropriate mitigation tools in place. You know, there are some good case models out there that have shown that these masks are really effective. They haven't necessarily been shown in the school yet, but we know there were two hairstylists, I believe they were in Missouri, and they both came to work sick. They didn't know they had COVID, but they came to work sick, and they each cared for a good 50 clients each, but everyone was wearing a mask. The hairstylist and the customer were all wearing masks. And clearly, if you're getting your hair done, you're within 6 feet of someone and you're there for more than 15 minutes. And in that situation, the hairstylist, the two infected hairstylists, did not transmit the virus to any of their customers. And they did this for about 5 days. They came to work sick for about 5 days, but everyone was wearing a mask. And I think that just reinforces how important and how effective mask use can be. Again, if you're wearing them appropriately and you acknowledge that kids will take them off and things of that nature, that's why it's going to be important for staff at the schools, teachers and others, to remind kids and really be the mask police and remind kids to put the mask back on.
I know it's getting late. It's almost 12:30 here, and so
Commissioner Grady.
Yes.
I'm sorry, sir, if I might. LaShawn Carter's had his hand up for a while, and if with your permission, I'd like to recognize him, if that's okay.
Please. I was just going to say we're running time. I was going to ask for other input. So, Mr. Carter, please.
Thank you, Commissioner Grady, and thank you everyone for your contribution today. And I'll try to be as quick as I can, but I do represent a population of young people that are especially vulnerable in this context. It's been referenced a few times, but I wanted to bring some perspective to just how vulnerable these young people are and how we can work together to support them. One of the things that's important is that we know that in our system, for those that don't know, I represent Franklin County Children's Services, the Child Protection Agency for Central Ohio, or for Franklin County specifically. We know for certain that we normally see and can expect spikes in our referrals around the time of back to school. And why that is, just really quickly, is because this is when our mandated reporters get to see children for the first time after a long period of time out of their presence. And this usually results in referrals being made because you're seeing things that you did not have an opportunity to see for at least 2 to 3 months. Now, what we also know is that that's an opportunity to engage with children and families in a way that's specific to their protection, but also helping our mandated reporters understand their role in keeping children safe, and also keeping and informing the community of how they play a role in keeping our children safe. So by virtue of thoughtful planning and trying our best to future-proof our services, we've implemented a couple things that I think has been helpful, that I hope our school district partners here on this call could leverage, or at least think about, as it relates to how you are informing your staff, particularly your social workers who are not in physical connection with the children, but are still serving staff, student, and families. Two things that I want to pay attention to and offer us up as experts to be a part of the decision making. One is, as you are identifying educational neglect as a referral, as a point of referral, please invite us to those conversations to develop a strategy. We would probably need the courts to be involved in that conversation so that we have a better understanding of what does educational neglect mean in the context of social and educational distance. Some of the things that might play out that look like neglect might be a lack of access and opportunity and bandwidth. So, and how our parents are able to support distance learning. Those things need to be taken into consideration, because we don't want a surge in referrals and a surge of cases opening when the true issue was poverty or access and not necessarily neglect. So we need to have some nuanced conversation on how those referrals are going to be made. The second is truancy, in our role in helping to inform how attendance is being taken and what the attendance means, and how truancy referrals are going to be made to the courts, and how we can be a part of that conversation as well. And I'm gonna close on a couple things. So one is, what supplemental programs can be offered, what real-time interventions and what culturally responsive supports can we offer that are pro-social and work ready for activity for those who are transitioning into adulthood. So I'm specifically talking about our 17-and-a-half-year-olds that will be 18 by the time returning to school in some physical form. They might already be adults, and they need to begin thinking about what does school life after school look like for them. So we have some opportunities where we can leverage a digital learning platform that we are implementing with our community of partners that the schools can absolutely leverage at no cost to them, that offers a place for students to learn and grow and earn credentials that can be applicable in the community. So we can talk further about that. But then I want to end on this. So as we're thinking about hubs and crisis intervention, what ways can we place those interventions outside of the front door of child welfare? So if we recognize that we're trying to implement some preventative measure, how can we place those interventions in a space where instead of referrals are being made to us to penetrate a devastating system like ours, how do we put prevention services in this kind of community-based hub so that they don't ever come in contact with a system like ours? And so that's really the perspective that I hold. And the reason why I say that is because one thing we also know, tangled up in this COVID crisis, is the issues of race, class, and gender. And so we cannot separate the two, because this summer has proven that those two things are tangled together. And so we have to be thinking about how are we going to address this pandemic while also recognizing that our young people are experiencing a racial pandemic as well. And their perspectives and their understandings of how their identity is playing out in the streets is absolutely connected to how they're being addressed in the classroom. And so the question that I'll leave us with is, what curricular decisions are being made that can be leveraged, that takes into account the distance, the physical distance of COVID, but also the recognition that there is racial reckoning happening in our communities. And these young people need guidance and structure around how they interact across race and difference. And classrooms are a great place for that to be incubated, but we have to think about how we embed that in our curriculum so that we're moving forward their instruction from an academic standpoint, but also their social interaction. And so I don't want us to lose sight of that fact, because those young people, while they're trying to distance learn during the day, they're showing up at City Hall in the State House at night. And we need to inform how they do that thoughtfully. And this is an opportunity for us to think about that and not lose sight of it while we're trying to address the global pandemic. That's all I have to say. Thank you.
Thank you, Mr. Carter. Appreciate it. So I want to end by saying thank you to everybody that was on this call today and a part of the meeting. Thank you to all of our presenters. I want to say thank you to, we had several friends from City Council, from City Hall, staff members, including Councilwoman Liz Brown, who had to leave earlier, texted me, thanked us for putting together the presentation. And so thank you to everybody. The hour has run long. I don't know if my colleagues had anything they wanted to add at the end of.
Thanks, everybody. Yep. Thanks, everybody.
Thank you, everybody.
All right. Thanks, everybody. Appreciate all your input. We will continue to do all we can to help our families and our students as this school year goes on. Take care, everyone. Have a great week, the rest of your week.
Thank you, everyone.
Thanks, Steve.